Hey, you guys. Good evening or good night, I should say. I normally do these posts late at night because I'm coming from work. but on this post, I wanted to talk about some of my medication treatments. Like I said, this is a lupus post. This is not really about anybody else's journey. It's about mine's. Um, so another thing that I would share is that some of these treatments, you may have never tried. And if you haven't, and your current treatment is not working, then you might want to try it. For me, what I started with was a medication called mycophenolate mofetil, or um, brand name is Sosep. Sosep wasn't really a strong enough medication for me because Sosep had my just wasn't bringing my immune system down to a normal level. It really wasn't touching me. So the doctor was like, okay, we're going to switch your medication to a medication called azathioprine, or AZT. AZT was working for my lupus as far as like controlling it a little bit, but it was also bringing my white blood count super, super down, which made me more susceptible to, getting sick and having infections. And I was just really sick on AZT. So my doctor was like, listen, the azathioprine is not working. So um we're gonna try more of the infusion medication. So I was a little scared about trying the infusion medications because he said, well, you would have to go to the cancer center to get the infusion medication. And I'm like, I don't want to go to the cancer center. Um, you know, and I had a lot of qualms about going because I started thinking I was in the same, boat as people who had cancer, or I was as sick as they were. Um, I didn't want to see people that were like holding on to their life. It was just a lot to have to go to the cancer center. The good thing about this particular treatment, which was called Rituxan or rituximab, um, was that you only had to take it 4 times a year, but it was a 6-hour treatment. And so you basically just had to go to this like room where a bunch of chairs, and they take your vitals every half an hour, and you're just sitting there for 6 hours. But for me, it was more like 8 hours because I had a hard time. Uh, I have really bad veins, really bad IV access. So I had a hard time with um, getting IVs in. So it was more like 8 hours for me. Um, so I would do this treatment. You would do one treatment, and then 2 weeks later you would do the other one, and then you want to have come back for another 6 months, and then you do one treatment, and then come back for the second one, and then that was it until another 6 months. So this medication was different, but my doctor basically was like, this medication is not touching you either. Your immune system, your inflammatory markers are still up. So at this point, I'm defeated. I'm just like, I don't know what's going on with my body. None of the medication is working. I had other things going on. Um, and that was around the time I started having cardiac issues. And that's when they realized that, the Rituxan was not working. So enter Benlysta. Benlysta is also an infusion medication, which I started off with the infusions. These were once a month infusions. I was like, great, I gotta go to infusion center once a month. But good thing about these infusions were they were only an hour, but still had the same issue with not being able to do um, get IVs as easy as everybody else. So it got to the point where one day I really went to get my infusion, and they could not get an IV at all. I had to go get a pick line. And my crazy self had a pick line in. was trying to work with it in. And my job was like, hold up. You cannot come in here with that. And some of my coworkers will tell you that I really tried to come in there with the pick line, thought it was okay. But, they had to sit me down and explain that, having that opens you up for more infections, and then coming into a not so sterile place as a psych hospital, um, with that could put your life in danger. So we can't have you working with that. So, but it was also irritating me. So I think I went to the ER that night to get it taken out because it was just so like irritating. I never had it in for more than like 8 hours, unless I was in a actual hospital setting where I could flush it and do all that, or at least somebody could do it for me. Um, but I still had the issue of not being able to um get an IV. So then my doctor was like, you know what? The infusions aren't working as far as being able to get them. So I'm going to switch you to sub Q home injections. So that's my current treatment. Um, and the home injections are once a week. I get them delivered to my home. They send them to me for four in a pack, and I distribute them either in my belly or my thigh. And it's a little weird getting used to giving yourself medication because I never, I'm not diabetic. I never had no situation where I had to stick myself with a needle. So it gave me anxiety to have to do it. But when I realized how much better I felt once I did it, I was just like, you know what? It is what it is. I just take a deep breath and do it. And like it's not a big needle. Um, but yeah, so those are some of the treatments that I've been working on. Like I said, my current treatment is Benlysta, and I'm not sure if anybody else have heard of Benlysta, but it's a pretty good treatment. And like I said, I've been able to maintain working for the past couple years being on Benlysta. Um, and I'm really surprised that doctors aren't resorting to Benlysta as a first medication for people, because I felt like I had the medication run around in the beginning. And it's like, if y'all know that this medication is specifically made for lupus patients, why isn't this medication the first medication you guys are suggesting or offering? Um, so I also have like other medication I take in conjunction, like vitamins, and I'm on a steady dose of steroids, and um, just I do have a bunch of like deficiencies and things like that. But overall, the Benlysta has been keeping my immune system steady, and I'm just grateful that I'm able to find that treatment, because at one point I didn't think that they were going to be able to find the treatment that worked, because the ones in the past just didn't work. But yeah, so let me know if anybody have any questions about any of the medications I mentioned. Um, you can always send me a message, um, or reach out to me. I'm going to post this on Facebook. So hopefully, if anybody see this and they watch the whole thing and they have any questions, and they have lupus and they have any questions about anything, any medication I mentioned, you guys can reach out to me. But until then, stay great, be lovely.